This took our breath away today when the New York Times reported that New York City officials are making contingency plans for temporary graves in case coronavirus deaths exceed the space in hospital morgues. They're not at that point yet, but the number of deaths are rapidly growing. Sky News U.S. correspondent Cordelia Lynch is the American-based correspondent for Sky, which is headquartered in the U.K. She's been covering this story for the audience back home, and she spoke to a team working in the morgue at Long Island Jewish Medical Center. They're working 7 days a week in the midst of a pandemic with a sensitive task that simply didn't exist a few weeks ago, finding ways for families to somehow say goodbye to the deceased.
This time it was a FaceTime. So I did first let her see me, explain, what she's going to see, asking her if it's okay that she's, are you able to see this? Because we couldn't keep it the way we normally do as far as, having sheets, and it was a body bag and you're seeing her face. So that was difficult.
It must be very surreal and distressing for a family to have to look at their loved one on FaceTime.
I'm not going to lie, I cried.
Cordelia Lynch, U.S. correspondent for Sky News, has been kind enough to join us tonight. Cordelia, we keep saying some version of this. Grocers could have never guessed they would be heroic in this. They would be considered essential members of our society. Nor could the people working in this hospital know they were going to have quite this sensitive a role.
Absolutely, Brian. And you heard there from Lisa Kilfeather, a woman who normally looks after the administrative side of the work there in the morgue. And yet, because they are so tragically overrun with bodies at the moment, she has been drafted in to try and help move them. It is physical work. It is emotionally very demanding work. They are, as you say, working 7 days a week. She hasn't seen her daughter for 3 weeks. Such is the risk of possible infection. They were a very tight-knit team, and that is no surprise because of the nature of the work that they have to do, Brian. But they were concerned, too, about the very small percentage of COVID-19 victims that are going through autopsies, because this is a system simply overrun. A lot of the other hospitals in New York City that we've spoken to just don't have the capacity to deal with the dead. That's why, of course, we're seeing so many of those makeshift morgues outside hospitals, a sad symbol now of this COVID-19 outbreak. There at Long Island Jewish Medical Center, they have expanded. They have now 3 sites in which to try and place the bodies, but they still don't know where the days and weeks ahead might take them.
We ran part of your work that we're showing on the screen last night, what you did from the emergency room. And I suppose maybe it's trite, maybe it's accurate to say that sometimes the best mirror of what's happening here is from someone who is covering it for a different audience, seeing how the Sky viewers in the UK and elsewhere around the world are seeing us was very revealing.
Yeah, you're absolutely right. I mean, for me, I was stunned, quite frankly, when we walked inside of that trauma center. We saw the pace, the extent of the work, the starkness of the suffering. It was a room just packed with people struggling to breathe. I can still remember the clink of the oxygen tanks that they were ferrying back and forth to get into that very busy room. I can hear the whir of the machines as well. I can see, still in my head, those doctors and nurses rushing between the corridors. It was such a kinetic situation. You had a triage center outside where patients could go initially. Very swiftly, they were being moved on inside, and then many transferred to the ICU. 80% of patients in that ICU are COVID-19 patients. They're overwhelmed.
We'll continue to try to air your work. We thank you for coming on and talking about it, Cordelia Lynch.